Good evening. Thank you all for joining us. My name is James Johnson. I'm a constituent service coordinator with the offices of Congresswoman Lawrence. Unfortunately, the Congresswoman had a family emergency and won't be able to join us this evening. However, she made it very clear that she didn't want to wait to have this important information coming out to her constituents. So what I'll be doing this evening is giving you a brief federal update on what the Congresswoman has been working on, and then we will have an introduction of our panelists. So as many of you know, Congresswoman Lawrence has always been a very long-time supporter of our public school system. Prior to being elected to Congress, the Congresswoman served in the Southfield Public School Board of Education as the president, vice president, and secretary. Congresswoman Lawrence believes that it is critical to ensure that our schools have access to all the funding and support they need to ensure that our students are able to have a safe environment where they can grow and develop their critical skills. During the pandemic, school access to funds is more important than ever, and it must be provided on a level that is adequate to fit these trying times. As parents, students, and educators learn to navigate the new difficult times, Congresswoman Lawrence, along with her colleagues, are doing all that they can to ensure that they support all of the households of the 14th congressional district. A prime example of this is that the House has passed multiple stimulus packages to provide funding. Most recently, the HEROES Act 2.0. Unfortunately, that's being held in the Senate right now. However, the Congresswoman, as an appropriator, was able to pass other legislation that has directly funded our schools. There's been $73.5 billion in discretionary funds to the Department of Education, $16.6 billion in Title I grants in local educational agencies, $14.1 billion for education in general, and then $25.13 billion in funding for child nutrition programs to provide free or reduced school lunches and snacks for children who qualify in the program. The House has also attacked a lot of other educational issues right now. The Strength and Diversity Act of 2020, a historic proposal which local communities in their efforts to desegregate public schools, and the Equity and Inclusion and Enforcement Act, which restores the rights of students and parents to hold schools accountable for discrimination within education. Last month, Congresswoman Lawrence also introduced a bill with Representative Casson that would address sexual assault and sexual harassment occurring in grades K through 12 by helping uphold student rights and be an advocate for the students. Earlier this year, along with Rep. Tlaib, the Congresswoman also was able to co-sponsor the COATS Act. And this act was to help with transparency in charter schools to make sure that our schools are all giving kids an equal and fair education. The Congresswoman has also done several things for the, in general, during the COVID pandemic. And since the pandemic, about 8.3 million Americans have been diagnosed with COVID, and tragically over 220,000 have died. To help offset these hardships, the Congresswoman, along with the House, passed the CARES Act back in March. Currently, during the flu season, the Congresswoman is very, very well aware of the pandemic and it being exacerbated. The well-being of all of our constituents, students, and parents, and all individual families are important. And the Congresswoman wants you to rest assured that every bit of legislation that will help move families, small businesses in our state and our schools forward will be addressed. With that being said, I want to get to the meat of the matter here, and that is going to be our panelists this evening to discuss the schools and how they are working through the pandemic. So first, I would like to introduce to you Dr. Wanda Cook-Robinson. She is the Oakland County School Superintendent. Dr. Cook-Robinson, would you please make an opening statement?
Yes. Can you hear me well?
Yes, ma'am.
Good. I want to say good evening to everyone. And also I want to send prayers and thoughts out to Congresswoman Lawrence and her family. I also want to say hello and thank you to all the parents that are with us this evening. I want to thank you for your support in providing educational opportunities to our students over the last several months. You know, first and foremost, this is a health crisis. Therefore, you know, in Oakland County, our educators, we've been working closely with our health professionals for guidance every step of the way. And I'm very pleased to see that one of our partners, Calandra Anderson, is on with us this evening. I know that all of us on the panel, that we share the same passion and concern for our students as we navigate this unprecedented health crisis. We have two important initiatives that we are partnering with our Oakland County Health Department and our Oakland County Executive's Office. The first is our Oakland Together Public Nurse Initiative. Oakland County Health Department has hired over 68 nurses that have been allocated across Oakland County to our local districts with a minimum of at least one nurse per district, and depending on the size and other criteria that we develop together, they could have up to 3 nurses. The nurses help us to provide consultation support, leadership, and professional development activities that are related to COVID. Our county executive's office and the commissioners have provided a grant opportunity to all local districts and public service academies to help them with COVID-19 related expenditures. So these 2 initiatives have had a tremendous effect on what we've been able to do. You know, I know that all of us on this panel share the passion and concern for our students as we navigate this unprecedented health crisis. But the educational community certainly understands how important our schools are to restarting and strengthening our Michigan economy. And we are struggling with all of these issues that surround bringing our kids back to school. In our county, the majority of districts started school virtually. And as we approach November, we are looking at a continuum. On the left side of that continuum is totally virtual, and many of our districts will offer that total virtual option to parents. But then on the other side is returning face-to-face. And we have a variety of options in between. So all of our districts, again, will have that remote option, but many are going to a hybrid, particularly at the high school level, kindergarten through 8th grade, looking at more face-to-face, attending more days. You know, I also want to share that the resources, all of our districts have on their website resources for parents and teachers to provide that additional support for their students. And I also want to share the partnership that we have with public television. Public television stations are partnering with educators across the state. We will have a Michigan Learning Channel, and they will provide instructional content that will support the work of teachers and parents. And it will be universally available on a variety of platforms. And they'll have a pilot starting on November 2nd. So a lot of good things are happening. I'm very proud of our educators stepping up during this time and doing the best they can to provide the safest environment for our students to return to school.
Thank you, Dr. Cook-Robinson. We really appreciate that information. Our next panelist is Dr. Nikolai Vedi, the Superintendent for the Detroit Public Schools. Dr. Vedi, your opening statement, please.
Thank you, and thank you for creating this panel so that we can talk directly to the community. And in my opening remarks, I want to thank Representative Lawrence for all the work that she's doing. I know that you outlined everything she's doing at Congress, but I can tell everyone listening, and I would say this even if I'm not on a panel created and facilitated by Representative Lawrence and her staff, that without Congress's passing of the initial CARES Act and the HEROES Act, we could not move forward this year with providing face-to-face instruction. Because of those funds, we had extra money to put a nurse at every one of our buildings this fall. We paid for temperature checks. We paid for the deeper cleaning of our buildings, deeper cleaning of our school buses. None of that would have happened without Congress's support. And there was nothing from the executive branch that was going to initiate those funds. It was purely Congress that advocated for that. So I want to be very clear and upfront, and that's not a political statement. It's a statement based on reality. But for us at DPSCD, from the very beginning, we felt that it was important to provide an equitable access to traditional public education. So if kids in private schools could go to school face-to-face, then our kids should have had the same opportunity to do that. So we worked with our teachers union to create a letter of understanding and to allow us to do that. That was negotiated and executed. And when the school year started, after surveying our parents, about 80% wanted online learning and 20% wanted face-to-face. So about 10,000 of our students are either face-to-face or going to a learning center every day throughout the district. All of our schools are open. All of our schools are offering breakfast and lunch. All of our schools are staffed with a nurse. If students are online, then they can still access breakfast and lunch through the school that they normally would. We were fortunate to raise about $20 million to the business community to provide every DPSCD family with a free tablet. And that tablet had embedded internet access. That allowed us to help narrow that digital divide reality that we're struggling with. All of our curriculum is accessible online. So as students started this fall, they could access everything from K to 12 online. In addition to that, we offered the printed materials because some of our students learn better through the hard copy as opposed to the digital. So we did that as well. Now that we're ending the first quarter, we're resurveying our parents to ask whether they want to revisit their initial request for either face-to-face or online, and doing the same thing with our teachers. I'll just conclude by saying this is hard work. It is always hard work, but even harder in a pandemic. But I want to lift up our teachers, our administrators who continue to fight through all the challenges that they normally fight through, but have been added to a series of challenges because of this pandemic. I know our parents are doing everything they can to support their children at home. Please continue to do that. We don't want to put our students farther behind in the learning process. So just continue to work through the day-to-day learning challenges online, and know that if you feel overwhelmed with supporting your child at home, you always have the opportunity to send them to school, and they can participate in the learning center where an adult would be there to not only supervise, adults there to feed children, but also address academic issues at a high level as they learn online through their tablet or laptop. I'll end there. One thing I do want to add, we have hotlines for mental health for all of our parents, all of our children. We also have a hotline for IT support and device support if the tablet that they have is not working, or they just have general questions about accessing learning on a day-to-day basis. And you can find all of that on our website. I know I forgot one thing. One last thing. Every time we have a positive case in our schools, we report that to our parents through a phone call and a text message. We have a website dedicated to showing our positive cases, linked to every school. We've had about 20 positive cases, but no outbreaks in DPSCD. And outbreaks are defined by two or more individuals being positive that are not family related. So we've had 2 or more cases at a school, but they've been family related, not non-family. So we have not had an outbreak at this point in DPSCD. We continue to monitor the infection rate for the city. Although rates are increasing throughout the state, in Detroit, for the most part, we're keeping on our mask, social distancing. So our rates have not increased like they have outside Detroit. So if our infection rate reaches 5 to 6%, the board and I will have a conversation about possibly not allowing for face-to-face to occur. But right now our rate is at about 2%, which is significantly lower than what we're seeing throughout Michigan and the nation. So more than open to your questions later. Thank you for having me.
Thank you, Dr. B. I greatly appreciate it here. And next on the panel, we have Director of Student Services in Hamtramck, Menham Aouad. Director Aouad, opening statement, please.
Thank you. I appreciate the invitation. First of all, I'd like to thank Representative Lawrence and her staff for bringing us together this evening to talk about mental health services and in the context of COVID. I also would like to extend my thoughts and prayers to Representative Lawrence as she is dealing with a family situation. It is truly an honor to be here. It's truly an honor to work alongside many of my colleagues that I have known and worked with before. They are truly dedicated individuals in their profession. We need to recognize the magnitude of the spread of the virus and how that virus has disrupted our daily lives, especially our educational system. Hamtramck Public Schools has mobilized community stakeholders and partnered with many agencies to organize the work that's needed, that needed to be completed to ensure the safety of all of our students and to plan for the start of the school year. We didn't know what kind of a school opening we were going to have, whether it was going to be in person, virtual, or hybrid. So we planned for every eventuality and ultimately landed on a virtual start of the school year. So it took a lot of work. It took a lot of collaboration with stakeholders to help us build and ramp up our safety protocols, our cleansing and cleaning protocols, as well as our procedures to allow students into the building after they have been checked and cleared for admission. I agree with Dr. Wanda Cook-Robinson as well as Dr. Vedi with their sentiment. And they mentioned many of the elements that I'd like to speak to. However, that aside, politics aside that's involved, I'd like to continue to encourage people to focus on the needs of our students and our staff as they rise to meet the challenges that we are facing. The digital divide, as Dr. Vedi mentioned, is a critical area for us that we needed to address. And we have made a very strong effort to make sure our families have the devices and the technologies that is needed to ensure that their students are connected. We have conducted our surveys, and our surveys are showing us that our students' engagement and participation is upward of 95%, which is phenomenal for us. There were some buildings in the district that had 100% participation, which is great, and we want to encourage that rate and that level of student participation going. We also want to recognize the work, the hard work that our parents are putting in to ensuring that their children are engaged. I have the ability to sit in on some meetings between our staff and our parents, and I see firsthand how our parents have a divided attention and they're multitasking between working from home, but at the same time ensuring that their student is still engaged and paying attention in online instruction. So we recognize what parents are going through. We understand what their daily life is looking like, and we want to continue to support them and acknowledge their effort and their work. We also have opened various learning labs for our English language learner students, as well as our students with unique special needs for whom a structured learning environment is needed. That's where they strive. They need that personal attention. We are monitoring the district's rate of infection, and we are communicating that information on our website, and we are working with our staff and students to take the appropriate measures to mitigate the potential outbreak. These are truly unprecedented times, the likes of which we do not have memory of in recent history. This is new to all of us, and we want to definitely appreciate the parents for enduring and partnering with us and collaborating and cooperating with us as we go through this year together. Thank you for inviting me, and I turn it back over to you.
Thank you, Director Aouad. I really appreciate it. And last but certainly not least, Calandra Anderson. She is an Oakland County public health nurse. Nurse Anderson, please, brief introduction.
Hi, yes, thank you for having me. I appreciate the opportunity, certainly. My name is Calandra, and I work for the Oakland County Health Division. And I've been there for about a year, and I got put on this special project, which is very important to all in our community. I've been a nurse in the community for 27 years, and by far, this is the most significant and impactful opportunity that I've had in my career. And I am excited to say that, as Dr. Wanda Cook-Robinson indicated, we have hired over 60 nurses to deploy in the 28 districts, as well as the 125 public or private districts, schools as well. Nurses that were hired were really vetted to ensure that they had some buy-in with our communities. So the nurses that are out in our Oakland County districts are either have some relationship through a volunteer basis, have children within the district, And so they really have a lot of buy-in, and they're supporting those districts. We really focused on preventative measures, and that is the key to mitigating the circumstances behind COVID-19. Our main focuses are three things. It is ensuring compliance with wearing face masks, teaching in the classroom, both face-to-face and virtually, the importance of hand washing for all grades, and the importance of social distancing. We developed this program in mind with feedback from the community, from parents and teachers and school officials, and information related to what is described through the CDC. And so we wanted to really focus on building protocols that are going to reduce transmission of COVID-19. We started earlier in the summer with putting together a toolkit that really focused on those preventative measures in line with the governor's roadmap. And then we kind of took it a little bit deeper and focused on what schools will need to really be safe, and what are some of those daily questions that schools officials are getting and parents are asking. And so we really wanted to put together protocols on how to properly respond to positive cases of COVID-19 that were reported either to the health department directly or reported through the schools through parents. And then we really wanted to focus on what happens when children are in school and they begin to exhibit symptoms of COVID-19. So we developed training materials, basic COVID training materials that we were able to go into the school system and talk directly with the folks that are on the front lines and answering the phones from parents calling in. And so we've developed those protocols. And then we really are working with superintendents to determine who are those point people within their schools that we need to work directly with to make sure that we're communicating across all levels within the school system. And we have been through over 80 campuses within Oakland schools doing school walkthroughs, looking at signage, looking at health screening stations that are set up, looking at the ability for classrooms to be able to cohort students and social distance properly. We've been providing guidance related to playground activities, lunch activities, and other arts and crafts and things like bands and choirs, all supported through recommendations through the CDC. We've done a lot of great work here, and we still have a lot of work to do. I don't think that there's ever going to be a time where we're going to be comfortable and let our guard down. We're increasing our education even more and more as we see cases rise in Oakland County. It's very important not to only educate the children, but to educate children, to educate their parents as well. And so we continue to do those things. And so where we are right now is we're really heightening those preventative measures, because we can't talk about those things enough: social distancing and wearing face masks and proper hand hygiene. You know, we feel that nursing, nurses are what I consider servant leaders. Nurses are ones that typically put others' priorities above their own. And a lot of these nurses are working full-time jobs within hospital systems and other areas, and also taking on this responsibility in working with schools. And a lot of these nurses have already been in the battle with COVID related to the hospital side of caring for folks that are positive with COVID-19. And so these nurses take this personally, the importance of educating, and they have the passion and the drive to be able to work closely with schools, closely with parents, and you know, have that level of empathy to provide. And so we have the perfect people within the school system. You know, years ago we had school nurses in pretty much every school. And as we grew, that position kind of, you know, fell by the wayside. And we are so happy that Oakland County has district employed nurses that we've been able to partner with as well, because while we're there in the school system through our grant, we're also working directly with those district nurses to look at other areas like seizure and asthma and allergy, and helping diabetes management and developing protocols in conjunction with those district nurses. So we've had such a great welcome to the school district. And I'm very new to schools, and I've learned a lot in a very short period of time. And we look forward to the continued partnership with Oakland schools and partnering with parents as well. Very proud of the work that we're doing. We're getting great questions from the community and providing that education to support them as well. So thank you for having me here. This is such an important topic, such an important overtaking of COVID-19. And together, I think that as we continue to have these conversations, we're going to be able to continue to update the public as much as we can and mitigate some of those COVID transmissions.
Thank you so much. I greatly appreciate your time as well. To all of our guests here who are joining us, thank you. Although the Congresswoman was not able to be here, I want you to know for your questions, she has dispatched multiple members of her legislative staff, so we will be able to answer any questions that may be related to that. At this time, though, we are going to pass it over to Jacqueline Elliott, our district director here for the 14th Congressional District. Jacqueline's going to facilitate our questions. We have a few questions that have already come in. Our panelists are here for the duration, so we are going to open it up now without further ado. Jacqueline, if you please.
First of all, I would like to thank all of our panelists for taking the time to join us for such a very important conversation. As many of you probably saw yesterday with Governor Whitmer's address, we know that COVID numbers in the state of Michigan are rising. Plans with education have been fluctuating along with the numbers and things that Governor Whitmer has been doing. So we truly appreciate you all taking the time to address our constituents and let them know where the plans are for each respective school district between both Wayne and Oakland County. And our main goal here is to try and answer as many questions as we can related to education, what's next, how we can protect both students, teachers, and parents during this time. So again, thank you all for joining. One question that we received ahead of the town hall was, are you considering setting up a distribution center with basic necessities to help all families of DPSCD students? And Dr. Vedi, it looks like this one is for you, but Dr. Robinson, if that applies to Oakland County as well, please feel free to address.
So we, all of our schools are open for food, breakfast and lunch, and that is for all online and face-to-face students. And so any partner that's providing services or supplies or resources beyond what we would normally do as a school is more than willing to reach out to me directly in order to offer the school being a distribution site. So some of that's happening at individual schools, but our focus right now is obviously food and educational services. We do have a mental health hotline. We do have a nurse at every one of our schools. So that's available to the public as well. So if there's anyone out there listening that wants to use our schools to give out resources, then we're more than willing to do that.
Yes, and I would just like to add, as for our listeners, I want them to know that Oakland Schools is an intermediate school district similar to Wayne Risa. So we work to coordinate across the county. Each of our local districts are still providing lunch to all of our students, and in some cases providing food for over the weekend. If there are additional needs, we have at Oakland Schools, we have Sue Benson, and if you can't remember that name, just contact me and I'll put you in contact with her. We have a unit, and their job is to provide that kind of support to the local districts and the Oakland County community. So you can either go through your superintendent and they can contact us for additional help if you have basic needs, food, shelter, those things. But we have about 8 folks that work on this on a daily basis. So contact me or your superintendent and we will do what we can to support those needs.
Thank you both so much for those answers. Mr. Aouad, do you have anything from Hamtramck? Do you know about anything with those services?
Yes, thank you for giving me the opportunity to respond. Similarly to Dr. Wanda Cook-Robinson and Dr. Vedi, Hamtramck does have nursing staff on staff. We are utilizing our nursing staff to help us with some of the healthcare plans that are needed, some of the screening, in conjunction with our nursing staff, as well as the health clinic that we have at Hamtramck High School that is run in partnership with the Detroit Children's Hospital. We do have medical social workers available to help respond to our parents, their concerns, and to help them coordinate referrals on where they can access services. We have distributed food to our families that included breakfast and lunch, and we have opened learning labs to address educational needs of our students. We do have a technology support hotline. We are also in the process of employing staff for the sole purpose of providing tutorial services to students that need that additional academic support. We have also mobilized our restorative practices group, as well as our PBIS group, as well as our mental health providers, counselors, and social workers to develop a list of community resources that is made available to our parents who are identifying as being in need. We are also partnering with our parents through our social workers to help facilitate problem-solving concerns that they may have accessing some social benefits that are now emerging as a need for our families. And again, all of our information is on our webpage, and we encourage our community members to reach out to us so that we can better understand their needs and work with them on accessing the services that they need.
Thank you so much. And so just as another note for all of our guests joining us, if you are joining us via Zoom, there is a Q&A chat at the bottom of your screen. If you have questions live, feel free to enter them there to be asked, or raise your hand and I can allow you into the chat. So those are the ways that you can ask questions via Zoom. If you're joining us via Facebook Live, please feel free to put your questions in the comment section and we will address those questions as well. Our next question involves low income and homeless children, parents, and how we're able to help them during the remote learning process. The question is, what is being done to help low income and homeless families that have children that are doing remote learning? There are a lot of grandparents with their grandchildren and they need even more help. How are we helping them? So that looks like a two-pronged question. So the access, when we talk about access to internet and the devices needed to actually participate in remote learning. And then the second part of that question being, how are we helping our older and less technological savvy parents and grandparents during this time?
We go first? I'll go ahead and take it. So all DPSCD families that were enrolled in our district last year received a free tablet with a Bennett internet access. And that was all students. Newly enrolled students in DPSCD this year received a refurbished laptop with internet access as well, and the potential to do that. For our parents and our grandparents, we run Parent Academy sessions where parents and grandparents can learn how to support their children online at home. And those are free of cost. We've been running those sessions since the beginning of the school year. They run during the day, the afternoon, and even in the evening and the weekends. And you can stay at your home and just log in to the device that you have in order to receive support. We have a hotline, a homework hotline, and an IT hotline. And you can get that off the website. That number, parents can call, grandparents can call for support on how to use the device or help children work through their academic challenges. We have done home visits to all students that have not regularly attended school or showed up. We've hired additional staff to work with our homeless students in particular so that they can get access to vouchers for food, for uniforms, just about anything. We can help fill the gaps for those students that are facing extraordinary challenges because of the pandemic.
Great. Dr. Robinson?
Yes. For our homeless students, I'll start there. Again, we are working very hard with our homeless students to bring them resources. We've partnered with United Way, as well as we have a team of 8 social workers that work closely across the county to identify those students and to make sure that their needs are met. We are also providing support and visits to shelters where the students are and trying to ensure that they have a tablet to work on. United Way has been instrumental in providing funding for the devices across our county, and I understand Wayne County and Macomb as well. And we are still working with districts in Oakland if they have a need for those, trying to get them. In some cases, districts have ordered them, but the demand has been such, as you can imagine, that they're on back order. So even those districts that have funding to purchase them have had to wait. And so we've had our local districts breaking down the labs in the schools, sending those units home and doing everything they can to make sure that every student has a device. There are also hotlines, not only at the county, but also within the local districts that parents can call to get help, and particularly grandparents. And being a grandmother myself, I understand this issue greatly, particularly as things have changed over the years in our schools.
Thank you so much. Mr. Aouad, did you have something to add to that?
Yes, and I appreciate the feedback from Dr. Wanda Cook and Mr. Vedi, spot on with what we are dealing with as well. I would like to take an opportunity to recognize our foster care support staff and our McKinney-Vento homeless support staff. They are phenomenal. They are doing all of the awareness activities that they need to do with our staff. And they are communicating what we need to understand and how we need to respond to situations as they arise. I also want to recognize our community liaisons. They have been phenomenal in supporting us with our outreach effort to reach families that have either not reported to school this year, or when our students start to show a troubling pattern of attendance and logging in online. So we have an internal process for identifying the students and a system in place that we use to rely on our community liaison to help us with the door knocking and engaging parents in the conversations. And I don't want to minimize the situation. I recognize that a lot of our parents have to work, and they have to rely on their children to do the right thing, which is to log on and participate in learning. But I also know the nature of children and how distractible they can be. So we are tracking and we are intervening as we see the need fit. We have also made several large purchases of electronic devices to distribute to families. I think we're on our 3rd or 4th order, large orders for computer devices to be distributed. We used a triage model. If a family has the means and the resources and the devices already available, we took that into consideration. We prioritize families that do not have those devices and do not have the means. Secondary to that, we prioritize large families that have multiple children that are competing for computer devices, access, and availability to participate in their learning. So large families tended to have issued to them more than one device to accommodate the needs of our students. My colleagues on the panel addressed earlier the digital divide. We recognize that Wi-Fi is an issue and not every family can afford that. We are currently in a conversation with our transportation department to determine if we can distribute vehicles around the community with a hotspot that students can tap into. One of the challenges that we are seeing is the overload that our network is experiencing when you have a large volume of students trafficking information over the network and how slow that's becoming. So that's a concern that we continue to address and tackle. But I think we're moving in the right direction. And I think our student engagement and participation rates speak to that.
Right.
Yeah, go ahead, Dr. Vedi.
I just wanted to let everyone know, I referenced it and I didn't have it in front of me, but I referenced a hotline. Any parent, any grandparent can call 1-888-466-3978 to access the homework hotline, the mental health hotline, or our IT support hotline. And those run mainly Monday through Thursday from 5 to 8 p.m. And then the IT support is Monday through Friday from 8:30 a.m. to 4:30 p.m. So again, 1-888-466-3978, and anyone can call to provide support in those areas.
Can you say that number one more time, Dr. Vedi? I'm putting it in the comment section for
Sure.
everyone to reference it there.
1-888-466-3978.
Perfect. So I'll make sure that that's in the chat so that if you all need to access that later, we'll also put any resources shared. We will have that on our website, which is www.lawrence.house.gov as well. Another question that we received ahead of tonight's event is for Nurse Anderson. The question reads, we keep hearing about the ways the virus can move from one person to another, but those keep changing often. So what are the main proven ways or reasons to catch the virus that we should avoid?
That's a very good question. That really is the main question. You know, the CDC really does talk about the fact that COVID-19 is easily spread from person to person. And those preventative measures that we talked about earlier, the importance of hand washing, social distancing, and certainly wearing a facial covering are the three main things that we need to focus on. When we start talking about the spread of COVID-19, and we really are looking at how close people are within 6 feet for 15 minutes, for a cumulative of 15 minutes over a 24-hour period. Knowing how COVID is spread is very important. COVID is spread through respiratory droplets, meaning anytime someone coughs or sneezes or is singing, talking or breathing, they produce what we call respiratory droplets. And these droplets can be in large form or small form, and they can develop into particles. There is evidence by the CDC that still there is low risk transmission from surfaces when this is spread in the air. However, there also is a risk of airborne transmission, like we see typically when someone has like chickenpox or measles or tuberculosis. And that is where airborne transmission is, where you have these small droplets that kind of linger in the air for a few minutes, can even linger in the air for a few hours. So the best way to protect ourselves with COVID-19 and to reduce transmission of COVID-19 is to make sure that when we are sneezing and coughing, we're using proper etiquette by coughing into our arm or the cuff of our arm, and making sure that we're wearing masks, and certainly keeping a reasonable distance from folks when we're out in crowds. And you notice now that when you go pretty much anywhere, there's signage on the doors to wear a mask. Take those things very seriously, because when you are in a small area and folks are wearing masks or without wearing masks, ventilation is not as good as it is if you were on the outside. So when you're in an area that is closed in and there's poor ventilation, things can tend to linger longer in the air. So by using, common sense things like making sure that we follow the guidelines that are recommended for us, personal hygiene, are all really good things to reduce the transmission of COVID-19.
Thank you so much, Nurse Anderson, for that. As we've all been saying for the past few months, please continue to wear your mask and protect yourself and others. That is the most important thing that we can do. So thank you for reiterating that message to our listeners here today. We did get a question in the Q&A chat. And this is open to any of the administrators on our call. The question is from Ms. Barbara, and it reads, how can the community help by either donating monetary resources and or providing tutoring support?
Well, if it's okay with everybody, I'd like to take a jab at this one.
It's all yours.
Thank you. So before we get to material support and before we get to monetary support, we need to talk about the most important type of support. The most important type of support that we need from our community, from our parents, from our idols in our lives is to practice being a role model. We need our community members to increase their own awareness of how COVID is impacting them, how COVID is impacting their family systems and society in general, but to also be aware of the issues that we are dealing with. In regards to assisting, the best assistance that we can have is for our community to join together, to team together, and to help message out and explain and re-explain all of the preventative measures that need to be in place to help mitigate the spread of this virus. We need role models to help enforce social distancing requirements. We need role models to help enforce personal hygiene, personal etiquette that our nurse spoke to. We also need the awareness that children need to have these messages presented to them in a developmentally appropriate manner using the developmentally understood language and terms. We don't want to scare them. We don't want to catastrophize the issue beyond what it already is. We just want people to be on the same page to help raise everybody's awareness and help us take care of the little ones that are the most impacted from that. With regards to tutorial services, underserved areas are always going to need additional adult support to help students meet their educational targets. So the more we have people who are willing to give of their time and support the schools and the students. If you're good in science, we would love to have you. If you're good in math, we would love to have you. If you have the ability to take the concepts that we work on into a practical application to demonstrate that the practical aspect of teaching and learning, we would love to work with you. But I think before we get to monetary support and material support, the support that is really needed is raising awareness and getting to a common understanding on how we can work together to prevent further spread. Thank you.
Thank you so much. Dr. Vedi or Dr. Robinson, did you want to add to Mr. Aouad's comments?
I think that was very well articulated.
All right.
Yeah, I think everything was covered. I don't think right now it's about donations. I'm worried about the winter coming and maybe thinking about donations for coats, hats, things like that in the winter at an individual school level. It's really hard to volunteer in schools right now because we're limiting access to prevent the spread of COVID to the outside community. With the exception of employees and students, we don't really have much access to schools right now. And then so in general, not to repeat anything that was already said, I'd say the best way you can help our children is vote and really be thoughtful about who you're voting for. And there are clear alternatives and just do your homework to understand which candidates are strongly supporting traditional public education.
That is absolutely right. Everyone, as Dr. Vedi said, as we near Election Day, please make sure that you are exercising your right to vote. We do have additional resources on our website as it relates to vote by mail. We hosted a town hall about a month ago, so if you need additional assistance with that, please visit our Facebook page and view that town hall for assistance in that area. Our next question, as we talk about getting into flu season, like Dr. Vedi mentioned, testing and tracing is going to be key and vital to making sure that we're keeping everyone safe. And the next question is, what is the plan to test children to make sure they are remaining competitive in the required course material for their grade level through the pandemic? And also noting how are we going to track the testing for the children if there is an outbreak that happens within the schools.
Let me go first. So right now, go ahead, Dr. Cook-Robinson. Go ahead.
Well, I was just going to share. This has been a topic of discussion. I meet with the Oakland County Superintendents every Thursday. We've been meeting every Thursday since March, and we'll probably continue throughout this pandemic. And that has been a big issue for us in terms of the state testing and the state assessment, what that should look like, when we should do it, how will this impact our students' achievement, given that many of them have been in a virtual remote setting. The fact that we had a little bit of a rocky start in March and that we had to go remote so quickly. And so we've been playing catch up. So that is something that we will continue to discuss and have meetings with our state superintendent about. But I want parents to rest assured that we are still looking at assessing students. Across our county, we have been doing formative assessments, looking at the student growth over this time and using those results to design and guide instruction so that students continue. So I don't want our parents and our public to think that due to this pandemic and because we didn't have a state test, that we aren't assessing student achievement and designing and moving them, continuing to move them forward. That is occurring, and I'm assuming it's occurring in Wayne as I talk with Randy Lipa and with Mike DeVault over in Macomb. Their districts are also assessing student learning and using those results to guide and increase student achievement. So that is still occurring.
So no different. Go ahead.
No, Dr. Vedi, I insist. You go ahead.
I can't see your face, so I thought if you were about to talk, I would have let you just go. So yes, we're still assessing. We use something called iReady at the grades K through 8 in reading and math, and it gives us a baseline of where students are at in grade level performance. And then that's used throughout the year to guide interventions. We test again right after winter break. And then we test again at the end of the year if the students don't take the M-STEP. So that allows us to gauge where students are at. And then at the high school level, we take what's equivalent to a PSAT or an SAT test so that we know where students are at before they actually take the PSAT or the SAT through the state at the end of the year. And we use that to guide our interventions for academic support throughout the year at the high school level. And that's happening online or face-to-face, regardless of what model or vehicle the student is using to learn this year.
No, that makes perfect sense. And again, the next question that I really want to make sure that we address is the physical or scientific testing of our students, teachers, as far as if there is to be a COVID outbreak in school. Are there any plans on addressing that in any of the school districts represented today?
I'm going to let my partner, Calandra Anderson, approach that when she is on the calls with the superintendents where they have questions about the testing, the students and so on. And so we're looking to them to provide that guidance. So Calandra, can you speak to that for us?
Absolutely. Originally, the Oakland County opened up its drive-throughs in the summertime, and it was really related to adult testing 18 years and older. And as we dived into the partnership with Oakland schools, we really felt a need to open up testing for our smaller children, especially knowing that a lot of the reopening plans were starting with the lower L. So we reduced our age requirement for testing to 4 years and up. Through an appointment, Oakland County does drive-through testing 5 days a week in 3 different locations. It is free to Oakland County residents. So we encourage parents to utilize our drive-throughs for testing. The tests that are performed through Oakland County are considered a molecular test. It is the gold standard confirmatory test for COVID-19. And so we offer that service free. And I will send you that information to make sure you get that out to parents as well. I do also want to include, as well as testing, one of the major things that we're trying to do is keep sick children out of school to reduce transmission rates. The Oakland County Health Department has partnered with Beaumont, and there is a referral line, and I will send you this information as well. This is great information to get out to parents. We started last Monday. The Beaumont Referral is it's open from 5 a.m. until 8 a.m., which is the opportune time when parents are preparing for work, getting children up for the school day, and they're speaking to a health professional live. They can call and ask any questions related to any symptoms that children might be experiencing. The Beaumont system is working to give a consistent message in conjunction with the Oakland County Health Department. And they're also recommending testing sites where children can be tested if parents feel that their children meet those symptom criteria and need to be tested. So I want to make sure that I forwarded that information to you. So parents that are listening to this call, if you have any questions about sending your kids to school and you want to talk to a health professional about the symptoms that you are seeing in your children, please take advantage of the Beaumont referral line. You're not speaking to an automation, you're speaking to a live health professional. And secondly, we will make sure that you have our information for all of our testing sites where you can get a COVID-19 test 5 days a week free of charge. So we will provide you that information.
Thank you so much, Nurse Anderson. And as we approach the end of today's town hall, again, wanted to all extend our prayers to Congresswoman Lawrence and her family during this time, as she cannot join us today. But we also want to thank all of our panelists and staff for helping make this event a great success. There was a lot of great information shared here, and our plan is to take this event. The recording will be available on our website. It'll be available on our social media outlets. And of course, this will stream live on Facebook, so you can always go back and watch the live stream as well. If you all have any questions, we can be reached via our website. Again, that is www.lawrence.house.gov. We will connect with all of our panelists and collect any information shared here today and make sure that that is available on our website. You can also reach our office at 248-356-2052. Again, that is 248-356-2052, and we will be happy to help. Again, thank you all, both panelists and guests, for joining us today, and we look forward to connecting with you all soon. Please wear your mask, stay safe, and we will see you all at our next event. Thank you and have a great night.